Mr. President.
Next, Chris is going to come up and introduce our speaker.
Thank you, Mr. President. So oftentimes where we get involved with organizations in the community that really create a lasting impact in your life. So I'm thrilled today for you all to get to hear from the leader of Interfaith Health Center since 1994. Melissa Knight has led the efforts, and I want you to think of this, nearly over 30,000 different patients have been assisted at Interfaith. Multiply that by the number in their household. Everyone in a household is impacted when a parent, when a father, or a mother, whomever, grandparent, receives the benefits of Interfaith Health Center. It's remarkable what they do. They also have expanded to dental practices. You'll get to hear about that. One of the most impactful stories that I ever heard Melissa give was the time when they were told by someone of the impact, and you might be sharing the story, of the dental abilities that they had, and I'll let you tell because it is emotional, but and just the life-changing effects that their services have provided these families. Personally, Interfaith was the first nonprofit board that I got involved with on the foundation board. So it's fitting that in a couple of weeks, I think Jim's changing roles, that I get to introduce Melissa Knight, my friend and a great leader in this community. And ladies and gentlemen, Melissa Knight. Thank you.
First of all, let me say, I did not pay Chris to say that, and I did not pay Matt to say those things about Interfaith, but I appreciate the kind words across the board. You come to an organization like this, and before I jump into Interfaith, I want to just say what it means to me to be in this group, to echo a lot of what Matt has said. I look around this room, former board member, Carlo, a current board member, Dr. Powell's wife was one of our board members. You look around this room and you see individuals who have helped in so many different ways. I see people in this room who have helped in a lot of ways. Mr. Johnson's grandson, Nathan, is helping me with a little project right now. So you just look around this room and you see a group of individuals who give back. So first of all, just so I don't forget at the end, I want to say thank you for every person that any nonprofit you were involved with. On behalf of those individuals, I want to say thank you for what your club has done. And now I might get just a tad emotional when I say this thank you. I understand your wife is the daughter of one of our former volunteers, Dr. Nolan, and he is no longer with us, but he was a wonderful advocate, a wonderful volunteer for our patients, and just provided care to so many individuals. So thank you for sharing your father with us. Just wanted to take that second. And I did not get too teary. I was able to keep going. So yeah. Now for what I'm supposed to be saying, now that I'm here, Interfaith Health Clinic has been in existence since 1991. I have had the privilege and the honor of being there for the last 30 years. We opened our doors as a small nonprofit. We had 0 employees when we first opened our doors. A board member had to come and unlock it in the morning and come back and lock it up at night. That didn't last long. But, just that extra things. We only had volunteers provide medical, dental, and mental health services. We soon figured out that if you have only volunteers, there's a real struggle to provide continuity of care. And that's important to have that continuity. So we hired our very first medical director, and we went from 6 or 7 volunteer MDs to 90 volunteer MDs within 6 months. And it's because you just feel better when you know somebody is going to be there checking on the lab works, doing all those other things. Similar things with dental, similar things with mental health. Today, as Chris has said, we have provided services for just a little over 30,000 individuals. One of the things about our patients, and I think a lot of people do not understand, is that 50% of our new patients each year will be with us very short term. They come in with an episodic problem. They're between jobs and they're trying to work 2 part-time jobs until they can land back on their feet and get a job with insurance. So when I say they're with us short term, they're with us anywhere from 3 months to a year. The other 50% of our new patients each year typically work in jobs in industries that never provide health insurance. While our target population has and always will be the working uninsured that makes 250% of the federal poverty guideline and below, we also, basically, we treat our mission statement, which is, and you can't tell, I hope my current board members will close their ears. We have a wonderful mission statement that we've really wordsmithed. At the bottom of the day, at the end of the day, our mission statement is to fill the gap. People who have nowhere else to go. So yes, the working uninsured will always be our target population. However, we have, over the course of time, served other niches as those individuals needed help. I will still talk to somebody and they'll say, well, you help so-and-so, or this group of people. I'll say, well, no, we used to, but another program came along, and we believe very strongly that we don't duplicate services. We think that there's just so many of good people like you all that have so much time to give, and we don't need to be duplicating services. So while the low income uninsured will always be our target population, we try to help other groups as our capacity allows. One thing I want to say is that we are not a free clinic. We believe very strongly in the fact that you need to have a little skin in the game. We believe in being a hand up, not a handout, as an old cliche. Typically, a patient pays 10% of the private sector cost when they come to our clinic. Now, we have never turned someone away because they couldn't pay that 10%, but that is, the average cost is 10% of what it would cost in the private sector. So we work very hard. I also, and this is all the boring stuff that I need to tell you so that you're informed. And, you know, when I go back to my office and my development director, my medical director, and everybody starts saying, did you cover, I can say yes. In our medical services, we have an MD and some nurse and 2.5 nurse practitioners that provide the continuity of care and volunteers. We do everything in our medical services, or our medical clinic, as we say, that you would get in your private primary care setting. We are not just urgent care. We do urgent care, like treating infections, UTIs, that type of thing. But we are also doing a lot of chronic disease management. If you make minimum wage, and you were trying to go to the grocery store, you're probably not buying a lot of fresh fruits and vegetables and a lot of salmon. You're just not doing it. You're buying a lot of pasta. You're buying a lot of things like that. So the number of our patients that suffer from diabetes and other chronic diseases is higher than normal because they're trying to make sure they've got money to pay their utilities, their kids' field trip, so they don't always feel that they have the ability to make the best choices from a dietary standpoint. So we not only do urgent care, we do acute care, we do chronic disease management, and we do a lot of wellness and prevention. We were fortunate in 2016 to receive a grant to be able to open a healthy kitchen classroom. One of the many things in my 30 years that I missed the target on, we decided we would do cooking classes, how to eat healthy on a budget. Those went over great. I thought we could do exercise classes. So I thought Pilates, some stretching things. Nobody was showing up. We started doing soul line dancing. We started doing something, and we had to turn people away. So obviously I don't always hit the mark first time around, but we also offer exercise classes for our patients. So we try to offer a wide breadth because here again, if you're making minimum wage, you can't afford a gym membership, and you might not live in an area of town you feel comfortable getting out and walking in at different times of the day or night. Dental service is the same thing. We don't just pull teeth. We don't just do fillings. We do bridges, root canals, full sets of dentures, the entire gamut. The only thing we don't do in dental services, we don't do cosmetic things. We're not whitening teeth. We only refer out to orthodontics if it impacts the bite or, a tremendous maybe a self-esteem issue. But here again, our dental services are full service, everything except the cosmetic type of services. Mental health, behavioral health, we do the traditional 45-minute come in, sit down, have a talk with a therapist. We also offer psychiatric services, as well as the counseling services. So here again, we feel that we offer a full scope. In addition to all the volunteers who come on site, we have over 400 specialists who will see our patients in their offices at the same 10% of their standard fee or less. We have an arrangement with the hospitals where they will do the same thing. Now, that didn't happen overnight. It took years to develop those kind of relationships that we can send somebody for everything from an outpatient service like a diagnostic and MRI, something like that, to inpatient treatment for a triple bypass. But we have been very fortunate and blessed that we live in a city that truly wants to help keep working people working, that wants to do the right thing and help give that person the advantage of stepping up and doing more. Chris mentioned a couple of patient stories. To best describe, I've given you the facts. The facts are sometimes boring, but at least that will tell you kind of who we are and what we do. One of my we have had multitude of dental patients come through our clinic that got better jobs because their teeth got fixed. Now, if you had told me that they were able to eat better, if you had told me they were able to do different things because we fixed their teeth, but they literally have gotten better jobs. And I hate to say it about myself, but if I were interviewing two people that were equally qualified, I hope I would not let the fact that one didn't have all their teeth impact me, but I can't promise that it wouldn't. I'd like to think it wouldn't. And so we have had actually a United Way story was on one of those patients in their video, maybe 15 years ago, about a person who came and got their teeth fixed and they were able to move on. One of my all-time, when I think it really describes who our patients are, I was walking down the hall one day, and it was December, and a patient was standing there, had a white bag, and that's normally what we put their medications in, because we provide a lot of our patients their medication, because it doesn't just help to tell them what's wrong with them. If you can't help them get well, why send them home to work? It's kind of, our outlook. I assumed it was his medications, and as I walked by, he said, "I saw you on TV the other night. I want to talk to you." And I know Matt's heard this story, and I know Chris has heard this story, so I apologize, but he followed me to my office, and I said, "How can I help you?" And he said, "I saw you on TV the other night, and you kept talking about this thing called donor fatigue and how it was impacting so many nonprofits." And he said, "Is Interfaith in trouble?" So I assumed he was worried about himself. So of course I jumped right in and I started talking, and I said, no, Interfaith is good. Yeah, donations are down for this time of year, but we're going to tighten our belt. We're going to be here to meet your needs. You're still going to be able to, I was just on the roll, and he was just looking at me. When I paused to take a breath, he said, "Ma'am, I'm not worried about me." And I said, "Oh, okay." He proceeded to tell me how 3 years earlier, his wife had come to see us at the doctor's office. At the end of the appointment, she called him. She was still in the room with the doctor to tell him that we had diagnosed her with cancer, and she was devastated. So she went home, they sat down, they talked about it, they cried, they prayed, and she said, "Well, Interfaith has me an appointment with this oncologist, but I'm not doing it. I'm not leaving you and our boy bankrupt. I will not do it." And he said, "Ma'am," he said, "Honey, Interfaith promised that we could pay what we could, so we're going to at least start down this path." So they did, and he proceeded to tell me, he said, "My wife asked the oncologist after some more tests, what's the prognosis with treatment versus without?" And said the doctors looked at her and said, "I don't have a crystal ball, but maybe 3 months without treatment, but I hope to get you 2 years with treatment." He said, "Over the next few months, y'all send her to oncologist, hematologist, radiologist." He said, "You send her everywhere." Everywhere we went, those volunteers treated her just like she had all the money in the world. They never looked down upon her. They never said, we can't do this treatment till you pony up this much money. They took good care of her. And I said, well, that is wonderful. That's what we want to hear. He said, well, he said, but I lost her. He said, she made it 2 years and 9 months. Well, I could do the math. She said it had been 3 years that month, and he had lost her 2 years and 9 months after the diagnosis. So she had died just a few months before. It is now the holiday time. I looked at him and I said, sir, I'm so sorry for your loss. He said, well, I am too. He said, but, he said, so you see, he said, my boy is grown now and has a good job with health insurance. I did everything for my wife while she was alive that I could possibly do. He said, I'm not worried about Interfaith being here for me, but I want to make sure that Interfaith is here for somebody else's wife, somebody else's mama. He took the white bag that I had assumed was his medicine and set it on my desk, and he said, ma'am, he said, it's not much. He says, but what I was going to spend on my boy for Christmas and what my boy was going to spend on me. He said, you take that money and you promise me, again, that somebody else's wife, somebody else's mother has the same opportunity my wife did. Part of me wanted to give him the money back. It broke my heart that he had buried his wife 3 months earlier, and now he and his son had given away the money they were even going to spend on each other for Christmas. But he was a man that got up and went to work every day. I would have never insulted him in that manner. So after he left, I took the bag, and there was definitely 2 distinct types of money. One set was folded very nicely. One looked like it had been stuck down in a sock to be saved. Totaling $110. And so, you know, that was hard on Christmas Day for me, because I looked around my living room. We not only got what we needed, we got more than we really should have ever gotten. You know, I always say every Christmas I'm going to limit what we do, and then especially when grandkids come along. If you don't have grandkids, you don't know what you're going to spend on Christmas till you have grandkids. And he and his son were sitting in a living room with no presents to open because he gave to Interfaith. After Christmas, about a week after Christmas, I cleaned out my refrigerator, and I don't know about you all, but I tend to refrigerate my trash instead of just throwing it away when I should throw it away. So as I cleaned out the refrigerator, it hit me again. I was throwing away more than probably they had on their table Christmas Day. But yet, this Interfaith patient wanted to help others more. So I tell everybody, when you are helping somebody who gets up and goes to work every day, somebody who maybe doesn't get up and goes to work every day, but they have nowhere else to turn, and they've been told no, 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 they value what you give to them, what you help them to obtain. So to describe who our patients are, that man describes who our patients are. I can tell you countless stories of a child who was in 3rd grade who the teacher approached us and said, do you do sleep studies on a child? And we were like, well, we never have, but I'm sure we can arrange it. She said, the child is not learning, but we really feel that it's a medical issue. The child came in. I don't know why I tell this story after we've eaten lunch, but anyway, the child came in and had a chronic sinus infection. That's all it was. Have you ever been congested and you lay down at night and you can't sleep, but you sit up and you can breathe, and you sit up? So the child was sleeping all during school, but couldn't sleep at night. We got the child in, 3 weeks of strong antibiotics, got him in to see an ENT who took care of tonsils and adenoids because she had had so many infections, they were scarred. That was the beginning of in October of 3rd grade. She was on 1st grade level in every subject. The teacher could not get her to interact with other kids. I stopped and said something to her, and I said, tomorrow you're going to have your surgery, and you get the ice cream and Jell-O, and Finally, I got her to talk a little bit to me, but she would barely open her mouth. And I said, did you tell your friends about your surgery and getting to eat all the ice cream and the Jell-O? And she shook her head and finally opened her mouth to say, I don't have any friends. Nobody will play with me because I have bad breath. She had had a sinus infection for so long you could smell it. So it was a child who was not learning in school, was not adapting and growing socially. And again, I don't have a crystal ball. I can't tell you what would have happened to that child, but 3 weeks of antibiotics, getting her in front of an ENT who took care of the problem. At the end of the school year, she was on grade level in every subject but one. And the teacher said, instead of going by and tapping her on the shoulder to wake her up, the teacher had to go by and say, sit still, be quiet, quit talking, because she had become a social butterfly. For me, taking my kids to the doctor was a lot of times inconvenient. Neither of my children, and they're grown now, but neither of my children were sick on the day I didn't have a meeting or I didn't have a report due. They only got sick when I had 15 things to do. So taking my children to the doctor was sometimes inconvenient. But for interfaith patients, taking their child to the doctor is a privilege. My final patient story, and then we will open it up for questions or whatever. It was the 23rd of December. In some crazy idea, I thought it would be great to let our front office staff leave and me work the front that night, because we just had 2 or 3 dental patients, and I thought surely I could pull that off. It's been a while, but surely I could fill in long enough for those 3 patients. A young man, his wife was being treated in the dental clinic. A young man was sitting out here with his small children, and they were very well behaved, and we had thought this lady would be finished with her dental treatment by like 7:30. 8 o'clock comes, 8:30 comes. Finally at 8:45, she comes walking out. That's December 23rd. She comes out and she's got those cotton rolls all in her mouth. My first comment to her, and even after I've been in this business this many years, was, oh, bless your heart, you're going to feel terrible for Christmas, you know. Will you even be able to eat? You know, I mean, and she looked at me and said, I hope I am still in pain the day after tomorrow, because it will remind me how lucky I am to have gotten my teeth fixed. And then the volunteer dentist was walking out behind her, and she said, actually, my husband is in much more pain than I was. But he refused to get his mouth fixed until I got mine fixed. The volunteer dentist looked at me and said, can you stay a little bit longer? He worked on that patient till after 11 o'clock that night, making sure that that Christmas, they had the Christmas present they really needed and wanted. So when you think about Interfaith Health Clinic, and I am going to open it up to questions, but I never close without an ask. Not a financial ask, but today, if you go pick up your car and it is at the shop and there is somebody there that you think might not have health insurance, tell them about Interfaith. 80-something% of our patients, it's in the low 80s, 81% are in the service industries, because those industries tend not to offer health insurance. If the waitress who waits on you tomorrow, you think needs health insurance or needs health care, tell them about Interfaith. If somebody at your church, somebody at the PTA, please tell them about Interfaith. The final thing I'm going to say, because I look in here and I see so many people that I know are involved with so many different organizations. No matter if it was the clothing closet with the PTA, if it was CARM, if it is, you know, a food pantry, if you have given to any of those things, your time, treasure, or talent, Knoxville is still a small enough town that you have stood in line at Walmart, at the grocery store, in the hall, at West Town Mall, and you have passed somebody who was the recipient of your good graces. They didn't know who you were, and you didn't know who they were. But on behalf of all of those people that your efforts have impacted, I want to take the time just to say thank you. So, thank you for that. Now, do you have questions for me?
Do y'all have a relationship with the Vine Medical Clinic, and what do they do versus what y'all do?
The Vine Medical Clinic is a school-based clinic. You have to be a student at Vine or have been a student at Vine, and there are certain times that they can treat family members as well. Yes, we do have not a formal relationship, but I pick up the phone, you know, kind of, we have a child, do you have anything that this might help? Or they call us and say, we've got a mama who needs her gallbladder out, but we don't have the capability, you know, that type of thing. Does that make sense? Being a school-based clinic, they're much broader than most school clinics, but that started like that, and that's kind of their hub and a lot of what they do. Thank you. Yes, sir.
Listen, I appreciate you coming today. And would you share your big plans for the future and your capital campaign with the rest of our membership?
You let the cat out of the bag. Yes, yes.
Spoken like a fundraiser.
Yes. We're just in the very beginning plans of trying to broaden. We cannot do any more where we are at. You know, they refuse to move Broadway and they refuse to move Gill Avenue. So with that, there's nothing else. We actually kicked Dental out to a new location at the end of 21. And as I was telling somebody, when we did that, we were able to double our physical footprint, but we were able to triple the number of patients we saw because it was set up like a real dental clinic. We are in the very early stages of planning all of that. We have hired an architect, and we closed on the building yesterday. And so after I signed my life away, you know, I was able to say, oh, we own this building and now we're in debt, to raise the money for the capital campaign. But our hopes are that we can just continue to grow. We worked with the Metropolitan Planning Commission to try to target where the working uninsured was moving to, so that we could, you know, focus on that, because we've been in this place 33 years, so we're not like we move every few years. So with that in mind, that's, you know, we're trying to get that done. And yes, I left yesterday after signing a very large note, or at least it was the largest for Interfaith Health Fund. Some of you in the room would bat an eye, but for us, yes. So, and we're looking at adding a lot of additional services. When we first opened, we had ophthalmology on site, but to expand dental and medical, we had to kick ophthalmology out. Now, we still do ophthalmology services, but all of it is referred out. We want to bring ophthalmology back. We want to expand our mental health. We want to expand our physical therapy on site. We work with a lot of great physical therapy organizations, but sometimes a patient doesn't need 3 times a week. They just need 1 time to go home, do the exercises for a couple of weeks and come back. So a lot of those things we hope to expand. So yes. Whichever one of you first.
Melissa, do you have any fundraising events that these people may be interested in?
We do have Doctors versus Lawyers coming up. It's kind of a trivia night. And we divide the room. You either play for doctors or you play for lawyers, and we see who's the smartest. So yes, we do have that coming up. Thank you, Erin. Yes, Blanche.
I had a question. I've tried to advertise for you once, and that person works in Knoxville, but they live elsewhere. Is there any geographic limits? My sales pitch wasn't great either. It was just like, hey, this place, you might like it. I don't know if you have any suggested sales pitch.
We have no geographical boundaries. If you can get to us, we will take care of you. We do work with individuals, so the sales pitch would be literally, they have no geographical boundaries, you know. Now, we're not a walk-in clinic because we do use a lot of volunteers. We need to, you know, kind of know that you're coming. We do have next day appointments that you can call and get, but we do not have any geographical boundaries. If anybody ever says, well, I don't know, and you will find people have been told no so many times, they're hesitant to reach out. And so my advice would always, one of the things that we have added in maybe a year and a half, we now have 2 community health workers, and that means different things to different people. I call them, they're half of the old-timey parish nurse who would go out and help do things, and the other half, they're really navigating to help people get address their food insecurity, or to help get their utility bill paid, or, you know, whatever. And so a lot of times if somebody is hesitant, calling their community health worker and letting them kind of lead them by the hand through the process helps people feel more comfortable, instead it's, oh, I'm gonna call the front office and they're gonna ask me all these questions. The community health worker is really good to help with that.
One more.
I'd like to hear more about or something about the volunteer professionals, how they're recruited.
Well, the volunteer professionals, we recruit them in a kind of a variety of different ways. Like if it's a large medical group, sometimes we'll recruit corporately. We still get most of our professional volunteers though through this type of organization, speaking at churches, that type of thing, that a lot of times you find those who really have a heart to volunteer through this type of public speaking. So, but we use MDs, NPs, PAs, we use some volunteer nurses, but a lot of volunteer nurses, their hours match our hours. So we don't have as many nurses. In the dental realm, you know, we use dentists, hygienists, and dental assistants. In mental health, it is a little bit different. When you volunteer as a mental health professional, you're signing up to take care of that person. So an MD or a DDS can say, I'm going to come on the 3rd Tuesday and I'm going to give you this many hours. A mental health professional is volunteering to take Melissa, if that means meeting with Melissa 2 times a week, once every 2 weeks. So that's a little bit of a different type of recruitment, but they anticipate that. Does that answer your question? Okay.
Thank you. And Melissa, thank you